Minister Dr. Joe Phaahla admits that South Africa has a critical shortage of doctors. Answering a DA question in Parliament, he said one doctor treats around 1,000 patients. So to discuss this even further, we're now joined by the Chairperson of the South African Medical Association, that's Dr. Mvuyisi Mzukwa. Dr. Mzukwa, thank you so much for your time and good morning to you. I think quite worrisome, hence we're having this conversation, the Health Minister admitting to a critical shortage of doctors in South Africa. Why is this the case in the country? Why are we seeing this shortage?
Good morning, Tumelo, and good morning to your viewers, and thanks for having me in your morning show. Tumelo, this is a long-standing problem. As you know, we've been singing this chorus for a very long time. We've been informing the Department of Health, that there's a critical shortage. It's not the first time that the minister heard that we are really running short of doctors in the country. And the reason is clear. The reason is that government does not want to employ post-community doctors. Those doctors that have completed their community service, they are not employed. Go to the Eastern Cape. Those doctors are not employed. In fact, some of the government officials spoke to my colleague to say, open a consortium for these doctors. They must go to private. Same thing happened in Limpopo. Doctors were told that they can work in private because now they are independent. KZN's the same story. Government does not want to employ. Instead, doctors are going out of the country or they are going to private. It's not a surprise that there's a shortage of doctors.
What is the reasoning behind government not wanting to employ post-community doctors?
They tell us they don't have money to accommodate doctors. There's no money from Treasury. And what you do with that is that you put pressure on the doctors that are already on the ground, because you know that the burden of disease has increased and the population has increased as well. But with the healthcare professionals, it's the other way around. It's going down. And you expect that you are going to provide a quality service, to the nation. It's impossible. You can't provide a quality service. You can't be saying that, for 1,000 patients, one doctor must do that. What quality is that?
Yeah, and you bring me to my next question, because I wanted to quote, the DA here. Obviously, the minister then revealing that the country's doctor-to-patient ratio is currently at 1/3 per 198 patients. Also, 0.31 doctors per 1,000 patients, and the number, of course, of doctors is currently on the decrease. This reminds me of a conversation, Doc, that I had with the Young Nurses Indaba Trade Union, saying that it seems to be similar even with nurses, right, in our public hospitals, where one nurse has hundreds of patients to take care of. And their words were, we are being made accomplices to murder in this country. Is this the same with doctors, where one doctor has to take care of so many patients due to the shortage, and thus perhaps in doctors feeling overwhelmed with the work that lies before them?
Yes, government is setting up healthcare professionals for failure. If you allow one doctor to be attending to such a large population, what do you expect? I mean, if you go to hospitals, you do the same thing to doctors, what do you think is going to happen? The quality of service is going to be compromised, and that leads to litigation. And what is a problem now is that the money that has been given to provinces, actually that money is not going to go to services. It's going to settle the litigation. So, unless we sort out the issue of staffing, we're not going to solve the problem on the ground, because those healthcare professionals, one, they are exhausted. You know that we are post-pandemic, or we're still in the pandemic, but we've been through that 2 years already, and you know that they are not capacitated. Instead, you get that lip service, from the health minister, who says, no, these are frontline warriors. What warriors when you cannot take care of those doctors by capacitating them?
Absolutely.
You know? So I think it's a very empty words for me.
Yeah, but also I think it's quite a dangerous statement in saying that, healthcare workers are warriors, because just yesterday in observing Mental Health Awareness Month, we were talking about how overwhelmed healthcare workers are, how there's already stigma with them even seeking, mental health, help because of what they go through, because of the notion that they are seen as heroes. They are the heroes with the white capes, and therefore they can take on any challenge, but the repercussions on them as healthcare workers seems to be dire. With that being said, Dr. Mzukwa, we can go on and on about the challenges. What needs to be done? What's the urgency that you feel like needs to be attended to resolve this from government in terms of addressing the issue around the shortage of doctors?
The first thing is that there must be provision of leadership in government. At the moment, there is no leadership. Right from the minister, I can clearly say there is no leadership. First of all, you need to do that, both in government. I mean, that competent people, even in the national government, has gone overseas. That health department is not capacitated. Then you go down to provinces. It's still the same thing. So you need to sort out the issue of leadership. You cannot have a functional healthcare system without a proper leadership, competent people in the right place. The second thing is that you need to employ doctors, you need to employ nurses, you need to capacitate that healthcare staff. We can have all these things, have these summits. I mean, we had a summit with the president in 2018, and there was a compact. Even today, you're still singing about that, discussing, researching, but people on the ground are dying because there's no quality service. We are running out of time, and we are wasting time as well.
Right. Also, Doc, I mean, we hear government often speaking about the NHI, and I just wonder, how can then they implement the NHI with a shortage of doctors? Or perhaps is the plan to get private sector to be involved and fill in that gap?
Well, we all want, the universal healthcare coverage, and South Africa has chosen the NHI vehicle. And we know that, there's no focus at the moment, because even the pilots that they're talking about, in contracting, where you just take private practitioners and, take them to the healthcare institutions. But that system has been in place in terms of sessions. You need to change the thinking. Government must now outsource that. It must be the other way around. The second thing, regarding this issue of NHI, we are worried when we look at issues like Charlotte Maxeke, where government is struggling just to do one hospital. Just one hospital. I mean, in other countries, that building a new hospital takes days. Go to China. But if you come to South Africa, they will do one hospital for many years.
Doc, speaking of hospitals, I have to then slot this in before I let you go. We've just been reporting recently that, Charlotte Maxeke Hospital is expected, according to the government, to be fully functional from, I think towards the end of 2023, they mentioned. What is your comment on this, given that, we're talking about a shortage of, doctors, but also one medical, healthcare center less in Charlotte Maxeke, not being fully operational at this point. What do you make of this, and what gap this will leave, of course, in health in this country?
An empty promise, Dumelo. Remember that, that hospital, the dysfunctionality of that hospital leads to, pressure on the local hospitals. You know that Helen Joseph and other hospitals are taking pressure from that hospital. And same thing, healthcare workers are overwhelmed because there's an institution that is not working. And we don't understand why we can't have, a speedy recovery of that hospital. If we have all the minds, government strength, geared towards repairing that hospital, we don't understand why. I mean, how can you postpone, functionality of that hospital when people are having serious issues as we speak?
We leave it there, and I appreciate you speaking to me about this. Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa, thank you so much for your time.